A few months ago, I saved the life of one of my patients. Literally, I saved her life. Hi, I'm Dr. Mike Vernon, and I've been practicing optometry since 2001. So this patient of mine, a 79-year-old woman, who I had been seeing for several years, came to see me complaining of a few symptoms. She was complaining of tenderness around her temples, some discomfort while chewing, and she was also complaining of a tingling sensation on her scalp. And these symptoms had been coming and going over the past 6 weeks. My patient's age being older than 55 and the symptoms of tenderness around the temples, the tingling sensation of her scalp, pain while chewing, these are classic symptoms of an autoimmune disease called Giant Cell Arteritis. This is when the entire arterial system, all the linings of the arteries throughout the body become inflamed. This can cause a stroke, this can cause an aneurysm. It's life-threatening. This systemic inflammation can also specifically involve the eye. The temporal artery here that's inflamed and tender is upstream from the blood supply that goes to the eye. When the eye is involved, it's called Arteritic Ischemic Optic Neuropathy. Now, the unusual thing in my patient's case is that her eye was not involved. She had normal vision, her color vision was normal, her optic nerves weren't swollen, she had no loss of peripheral vision, her eyesight was normal. To further complicate my consideration of giant cell arteritis as a diagnosis was the fact that she was complaining of having a split molar, and she had made an appointment to see the dentist the day after seeing me. Was the fact that she was complaining of jaw claudication, which is a classic symptom of giant cell arteritis due to the split molar? I didn't know. However, when I lightly pressed on her temples, she winced in pain. And that was enough for me to decide this woman, my patient, needs to be seen by her primary care provider, have some blood work done to check for systemic inflammation throughout the whole body, and to have a biopsy of her temporal arteries. In optometry, there are 3 things that we consider emergencies. One is when you get chemicals in your eyes. Acids, bases, those need to be flushed out immediately. The second thing is when you have a condition called angle closure glaucoma. That needs immediate attention. One can lose their eyesight within hours of having that occur. The third emergency is giant cell arteritis. When giant cell arteritis is suspected, even before confirming the diagnosis with blood work and the temporal artery biopsy, the patient should be started on first intravenous steroids, methylprednisone, and then after that, they should be given oral steroids, prednisone. Once giant cell arteritis is confirmed via the blood work and the temporal artery biopsy, the patient should continue to take oral steroids to ensure that the inflammatory response is suppressed. 6 to 12 months is how long they should be taking oral steroids. Anyway, I sent my patient to her primary care provider right away, that day. Her PCP started her on steroids that day and ordered all the blood work and biopsies that needed to be ordered. A few days later, I got a message from her primary care provider that indeed she did have giant cell arteritis. A few weeks later, my patient actually came to the office unannounced, and she came in to thank me. She was beaming and so very thankful. Giant cell arteritis can cause complete vision loss in one and sometimes both eyes, and can even take someone's life. In my patient's case, not only did she not lose her vision at all in either eye, but she was being treated successfully for giant cell arteritis, and she was going to make a complete recovery. I literally saved her vision, and I saved her life. And that's how she framed her thank you to me. She said, "Thank you. Thank you for saving my life." Now, that's a thank you that I don't get to hear very often.